Conservative Media viewers, what's going on? It's me, John D. Villarreal, and I've got a special presentation for you. But first, I have to give the disclaimers. As you know, I'm not a medical professional. I'm not making any kind of medical claims. There's no medical claims in here whatsoever. It's up to you to talk to your own medical professional, make your own decisions. In fact, we're not making any factual allegations whatsoever. This is all my own personal opinion and the opinion of Dr. Jeffrey Miller. And this is all for informational entertainment purposes only. Check the disclaimers, all of them. In addition, we are getting paid for this video. You need to know that, but all these opinions are my own, and this is what I truthfully believe. Now, that being said, let's start on this. I'm excited about this because, as you know, I'm a 4-time national champion powerlifter. You know that. I was national to world class in 3 strength and combat sports, and I met Dr. Miller several years ago. It was actually he was introduced to me by a friend of mine who's also an athlete to help me with my competitions. He went on to sponsor me and help me win my last competitions, my last national championships. And let me tell you something. It really is so critically important. I've seen the difference in myself. I wanted to bring this to you. He's got some new incredible methodologies and technologies that he's bringing together that you might find beneficial. I definitely am someone that has benefited from this, and I think because I was in a situation where I competed at an elite level for 21 years, and you know, you do a lot of sort of damage to your body in that time. I didn't want to be in a situation where I couldn't walk later, where I couldn't do the things I want to do. When I had a family, I couldn't have that kind of fun with my kids and play around as when I was younger. So it was really important to me to say, okay, not only how do I look for someone that can help me compete and win those last national championships at a high level, but also what can I do to sort of repair and heal my body to give it the longevity and sort of try to reverse some of the damage that I've done before. Dr. Miller has helped me do that. I want to introduce you to him, and I want you to hear what he's got going on right here.
So we're now going to work in the shoulder area here. If it gets too hot, please tell me. And so you can see kind of what goes on when we do these type of treatments. And it's going to vary on what area we do it, but as John can tell you, he can feel some gentle warmth, and in certain areas it gets hotter, but that's really all there is to it.
It's not bad. It's no, I mean, was never one to go tanning that much or whatever, but it's really less than that or no different than that, you know what I mean, at a certain point. So it's really not a big deal at all.
No, it's not painful at all.
That's wild about that guy with the finger.
Absolutely. No, seriously, I mean, there have been so many patients, I can't even count them, honestly, who've had that type of result. And it's the most amazing part is, you know, honestly, because the technology is so new, we don't really know all the things it can do.
Yeah, exactly.
You know, I've had some patients ask me a question, like one patient, her and her husband both getting fantastic results on 2 different types of problems. He has neuropathy, she has chronic injuries from being a competitive, pianist. But, you know, she was a competitive, musician and pianist, and all kinds of problems associated with that. He has neuropathy. And they're both getting better, but she was telling me about, you know, her mom and some problems with her fingers. And honestly, I hadn't really seen the beginning stages like that before. Pretty serious problem, but probably the beginning stages of like an RA.
Oh, yeah.
Some type of autoimmune condition. And I honestly am not sure whether we can treat it. Now, we're going to try. We're going to do a demo treatment. We're going to make some decisions on whether or not it's a good idea to go forward, whether or not she's a candidate, and if so, what it will take. But realistically, I honestly don't know. I've seen the research on it. It should have some effect depending on what the cause is and how severe it is. But, you know, we're going to take it and see what's going on, how much of it's from joint damage, because she was also competitive, or how much of it's from RA, and make some decisions based on that. And that's kind of the exciting part about all this is, you know, we can do a lot of things for a lot of people. You can relax that arm, and if it gets too hot, tell them.
Oh, it's fine. And that's so was it her whole hands, or was it
all of her fingers?
All of her fingers.
All of her fingers, her forearms, and her elbows. And so we're going to be looking at all this. You know, it's pretty cool. And with a lot of these athletes, you know, you see all the guys getting shoulder injuries, knee injuries, you know, and they're just chronic and they're not going away. That's from that weakness in the tendons and the ligaments. That's from the nerve and muscle imbalance. And that's from the scar tissue that's developed in that area. And if we can do, you know, even a 30% long-term improvement.
Oh my goodness.
For a lot of these guys, that's amazing.
Yeah,
a whole different ballgame.
It's a whole different ballgame, you know. Just functionality day to day. And there's so many people, whether they played in the NFL or even a college ball or whatever like that, and there's a lot of people that just, they can't move that well anymore.
No.
You know, it is incredible. Why do these lasers work so well? Why, there's so many different. There's so many different like.
There's so many
Therapies,
different applications.
Yeah,
the reality is each wavelength of light is going to have a different effect. Like for example, this one uses 980 and 808 nanometers, which is the actual wavelength of the light. Now, if we wanted to cut skin, we'd use a different wavelength of light, so a different color. You know, if we wanted to go and do a different thing like burn off hair, we'd use a different wavelength of light. Each one is going to get absorbed by different tissues. Each one's going to have a different metabolic effect. You know, and all of these are built in that way. And I think we've just scratched the surface of what these things can do.
Yeah.
You know, I mean, I just see in our practice the combination of changing the wavelength, changing the frequency, changing what areas you do it on, changing the duration of the time. You know, you have thousands of different overall treatment plans because even with these 4 variables, just by modifying, there's 1,000 different ways to treat somebody. And it really is an art as well as a science.
That is amazing.
You know, you really have to have that touch of knowing what it can do for different patients, knowing what your outcomes are, and you're going to have to modify your treatment over and over again. That's why I say to people, it's so important to find somebody, whatever you're doing, whether it be surgery, laser, anything else, who specializes in the techniques you go to.
Well, and someone like you that is an athlete, that's competed himself, you know, and is using some of these techniques on yourself or, you know, whatever. I mean, you've used this stuff. You know what's going on. It's like you've also been there on the other end of it.
Oh, absolutely. I mean, you remember when I was first treating you, I had shoulder and neck problems to the point where at the end of the day, I was hurting. And, you know, I had to get treated 3-4 days a week, every week, for years.
It's amazing.
I mean, God, 1993, you know, 96 I started practicing, and all the way through probably 3 years ago,
Wow.
2-3 years ago. And just the laser techniques that I've had since then and the treatment I've had using the methods we use in our office have gotten me not quite pain-free, but close. You know, first time in my life I have no shoulder pain.
That's huge.
You know, for me, I have God knows how many dislocations in my shoulder. And, you know, even though I do the rehabilitation exercise and even though I get chiropractic treatment, it was always painful.
Right.
And now I've been able to break down a lot of the scar tissue,
That's right.
get the nerves to heal, and I don't have pain there on a regular basis.
Dude, I can really feel this. There's something going on in there.
Absolutely, it makes a huge difference. Not too hot, right?
No.
Okay, good.
Now, how many, I mean, obviously it's going to be different for everybody, and you're going to draw up a custom plan, and we were talking about that, why there is no one size fits all, but in general, you were talking about how many treatments would someone expect here?
Generally somewhere between 8 and 20.
Okay.
I mean, for a problem like this, if this was somebody's shoulder,
Right.
and this was their main problem,
Right.
I'd probably say they'd be coming in for about 12 to 14
Yep.
treatments. You know, in your case, you know, there's a lot of scar tissue in there, and I would really be realistic that, look, there's some damage.
Right, of course.
This is probably going to improve. Like in your case, we could probably get an improvement 50, 60, 70%.
That'd be tremendous.
Yeah, I don't know if we'd ever get you to where, you know, 100% there's no pain.
Well,
it's not-
I blew this shoulder out doing an exhibition in Boston. I was doing like 455 for 5, no, you know, with benching with just a t-shirt, and on the last reps, boom, it blew out. So that was back in like, I want to say 92, 93, and it's I've been living with this thing for, you know, I mean, close to
Many moves.
yeah, many moons, you know, almost 20 years now.
Yeah, that is a long time.
Long time. So I mean, like you said, a 50%, or anything above, you know, 50% or more kind of improvement would just be phenomenal.
Absolutely. You know, and that's really what we're looking for. And when you look at, you know, it's funny, people don't think, sometimes when you say those numbers, people go, wow, 50% off. But when you look at surgery, I mean, what are they going to tell you you're going to get back after
Right.
shoulder surgery?
Yeah.
You know, you'd be doing backflips if you did shoulder surgery and you had 50% of normal function.
Mm-hmm.
Reality is you're going to be weaker, you're going to have lower range of motion, there's risk of all kinds of things.
Mm-hmm.
You know, so it's a big deal.
Well, and look, the bottom line is everyone's living with whatever they're living with. You know, wherever you're at is wherever you're at. Better is better.
Exactly.
And, you know, and better where you don't have to take some of the risk of some of these, you know, drugs and surgery, stuff like that, is, in my book, a much, much better way to go.
Oh yeah, absolutely.
You know?
Much safer, long-term, much better. It's something that we're going to be able to do in the future. You know, this is going to become the standard of care. You know, obviously, unless you have hemophilia or a tumor or something like that, we rule that out. But yeah, the risk factors are ultimately low. And the big thing is, if it doesn't work for you, you can always go back to the surgeon. I mean, there really is no time frame on that unless it's an emergency case. And there are going to be our cases that we're not going to treat because they do need surgery. And that's, you know, that's just reality. Certain cases will need surgery, certain cases won't. If you're in the in-between stage, that's the one where, like your friend, you went for surgery and you probably could have done something else.
Yeah,
you know,
absolutely.
it's all about getting the best care.